If you're watching this video, hair loss is important to you or someone that you love. Losing the hair on the top of our head is a sign of that we're getting older, maybe we're not as healthy or as vibrant as we used to be, and that could be detrimental to your self-esteem, and I understand that. When we're losing our hair, we're really trying to reverse our aging process, aren't we? And if you know how that goes, you're looking at the hair that's either in your hands from styling or at the bottom of your sink or even in your brush. What are you going to do about this? There's two different ways that we can kind of classify hair loss. One is the slow and gradual. Two is all of a sudden it falls out in clumps or you're noticing a lot of hair loss in a really short period of time. These have to be handled a little bit differently. So when you come in for a consultation with us, we're really going to sit down and understand your particular health history and what's going on. Both men and women can suffer from hair loss, and lots of different things can happen to start this process or to even make it worse. So taking a step back and diagnosing what the problem is and getting a true treatment program specifically for you is really key. So what does PRP even do? So platelet-rich plasma, that's what PRP stands for, is a concentrated solution of growth factors right from your own blood. So the procedure is extremely simple in office. We take a small amount of blood from your arm, we spin it around in a centrifuge and extract out the portion of our blood that contains platelets, and we concentrate that down 5 to 10 times. That gets applied into the scalp with a very, very small injection, just in our different spots where we notice our hair loss. We do numb the area first, so it's more comfortable, but you are going to have some pain from injection site. A little Tylenol is okay. For most people, getting started with PRP, if you're a good candidate for this treatment, is about 3 treatments separated about a month to 6 weeks apart. And that's really essential for understanding the natural physiology of our hair. Our hair grows in cycles, and what we want to do is reawaken and invigorate those hair follicles to grow back again. So you see, as we lose hair, our hair follicle doesn't fall out, it's actually shrinking. So we go from a thicker shaft of the hair to a finer and finer and finer one, and then eventually it falls out. So most people actually don't notice they're having hair loss or hair miniaturization as it goes until about 25% of your hair is gone. Now, if you see a receding hairline or the actual part is starting to increase in between, that's a visible sign you should be getting treatment done sooner than later. Who's not a good candidate? You are not a candidate for PRP hair restoration if you've lost your hair and it's just skin or scalp. So that Mr. Clean, the guy who doesn't have any visible hair, it's not going to come back because there's no longer a hair follicle. And the hair follicle has a stem cell at the very base. Once that's gone, they don't come back. It's just skin, right? So those are not good candidates. But the sooner you notice your hair loss and the sooner you get treatment done, the better your outcome will be. And we have years of experience doing this. This is very, very safe and effective. We have to understand that multiple treatments are required. This is not a one-trick fix and you're done. This is a maintenance program. For most people, this is due to genetics, right? Our effects of testosterone and other hormones like your thyroid are going to directly correlate to how much hair loss you have. If you have suffered from an autoimmune disease, a rapid change in your hormones or stress, like a traumatic event, or you have an autoimmune disease, these are handled differently. It's a separate condition that we can also treat and use PRP, but maybe not quite yet. So that's a little bit more detail that we need to understand, and we can go over all this during your free consultation with us. So let us know if you have any questions. You can leave some comments down below or schedule your consultation with us, and we'd be happy to help you out. So thanks so much for watching, everyone. I'm Dr. Sorr. Be well.